Just wanted to welcome everyone to our webinar. We hope after today you will know there is help available and how to get connected. We have 4 speakers today and welcome your questions. Please use the Q&A feature to ask questions, making sure to include the speaker's name. We will answer as many questions as we can before the webinar ends. Quick note. We will be recording the webinar and posting it online for future reference. I will make sure you all have a link. Our speakers today, Laura Rocha, myself. I'm the Outreach Event and Events Manager of ActivMed Practices and Research. I've been working with ActivMed in the community, doing educational presentations on dementia and Alzheimer's disease and research, and the importance of memory screenings as we age. I'm a certified dementia practitioner. We also have Jennifer Patterson, Regional Sales Director of Elara Caring. She's a former social worker with many years of experience in the post-acute care, including VNA, hospice, and aging in place programs. Nancy VanBenschoten, Director of Business Development at Arete Rehab, has a background in senior living. She is also a certified dementia practitioner. Gayle Davis is the VP COO of Senior Helpers of Southern New Hampshire. Gayle is a Senior GEMS Veterans and Parkinson's Program certified. She is also a certified facilitator of the Virtual Dementia Tour. Today I'd like to talk to you about the importance of memory screening. We have our sugar, blood pressure, and cholesterol tested annually. Why not our memory? Every year we get a physical and have our sugar levels, blood pressure, and cholesterol tested. Most of us do not have our memory screened. Why not? Fear, denial? For the most part, people tell me they don't want to know. What are the benefits of knowing if you are having a decline in memory? Well, knowing if you have a decline can help you prepare and seek treatments that are being developed to slow down the progression or even stop your decline. Finding the root cause of your memory loss is the first step. It could be normal aging, an infection, or something more serious. How will you know if you don't get tested for memory screening? How can having annual memory screenings help you? Getting a memory screening will help you have a baseline and help your physician to monitor the progression from year to year. With a baseline, if there is a significant change, your physician can be more proactive in finding the root cause. Treatments can start sooner, and changes in your lifestyle can help. Sometimes changes in everyday activities can help your brain health. Changing your diet, eating healthy foods, and adapting your diet to adding more brain healthy foods like the Mediterranean diet can make a difference. Adding physical activities such as starting to walk daily, adding yoga or dance classes help your muscle memory and keeps your blood flow, bringing oxygen to the brain. Socializing. We all know this is not as easy during this pandemic, but reaching out and staying connected to your family and friends will keep the brain actively bringing up memories and creating new ones. Challenging your brain with puzzles, games, and trying something new keeps your brain learning and finding new ways to remember. Did you know not all dementia is caused by Alzheimer's disease? In some instances, memory loss or signs of dementia may be caused by another underlying condition. With a good memory screening, you could uncover a medical condition that may have gone undetected until it causes serious issues. A story that I have was my mother-in-law would go through stages where she would show signs of dementia, paranoia, memory loss, and have lots of issues. And it wasn't until bringing her to the doctor we found out that she was having issues with urinary tract infections. So every time we would see these symptoms, we would bring her to make sure that wasn't the root cause. So dementia is not a disease. It is a symptom of many different diseases, as well as can be caused by something like a urinary tract infection. Although Alzheimer's disease is the #1 diagnosis of dementia, amounting to over 65% of individuals suffering, there are many other possibilities. Parkinson's, stroke, urinary tract infections, as well as tumors can also cause dementia. At the moment, there are no available treatments for Alzheimer's disease, but we have been researching potential drugs and devices for years, and with some very promising potentials. But without a diagnosis, you can't begin looking for help and treatments. One of the things that we've been able to do here at ActivMed is when we screen someone for a free memory screening and they have gotten consented to look into one of our research studies, we've actually found that they had an infection, and in one case, someone had a tumor, and they were able to seek treatment, and it saved their life. ActivMed offers free memory screenings and recommends anyone over 55 get one annually. A memory screening baseline is very important to ensure you catch the decline early. When you start to have memory issues, your doctor can run tests to determine the root cause. It could be as simple as an infection. Remember, it also could be something more serious. Getting diagnosed early in any disease is a key to helping slow down the progression and start treatment. ActivMed practices and research is dedicated to helping find a cure for Alzheimer's disease, as well as many other causes of memory decline. There are close to 350 clinical research studies going on throughout the world to find a treatment for Alzheimer's disease. Although many are drugs, there are also studies of devices, lifestyle, music therapies, as well as specific diets being researched. The first step is having your memory screened. And at ActivMed Practices and Research, we screen individuals regularly, and we encourage them to come back for a free screening every year. Now I would like to welcome Jennifer.
Thank you very much. My name is Jen Patterson. I represent Elara Caring and want to just review some Medicare Part A benefits. We all on this call have the desire to ensure that our patients are accessing the benefits they are all entitled to safely age in place. VNA or home health services are a part of that. There have been some recent CMS changes. Some of the basic eligibility for VNA services are intermittent skilled nursing care, PT, speech, occupational therapy. One note to the current changes in our COVID environment is the change to homebound status. That used to be a pretty strict rule, but now there's a presumption that patients are homebound, so it increases the access to the home health benefit. They do still need the skilled need, but that requirement has been relaxed. Also, CMS has allowed for the telehealth visit that a patient has with their physician to qualify for the face-to-face visit, and also allow PAs and NPs to sign orders. What we're seeing, there's such a fear for patients to go to their physician or the offices were closed, that we want to help facilitate the access to that home health or VNA benefit. And so we're working very closely with physicians to make those orders so we can be the eyes and ears with that patient for them in the home environment. It's really important with the dementia patients that we have a comprehensive assessment of the needs and incorporate what they need into the plan of care. When we do that, we're first and foremost obviously doing a safety assessment, which is very critical and done on an ongoing basis to address the changing needs of the dementia patient. We will institute OT, PT. It's very important to have that in the plan of care for strengthening and the prevention of deconditioning, and really address that fall prevention. And we will incorporate, you know, appropriate cueing into that for the particular patient based on where they're at. It's also very crucial to educate and build in the other supports of the family and caregivers. So that could be assisted living staff or family members and caregivers, and really engage them in cueing techniques with the patient. And just some general best practices that we find with this type of patient is to really commit to rehearsal and repetition, using different things like alarms, signs on things, day planners and calendars, and really looking at that environmental aspect of the patient's environment and control the controllables. So, you know, noise, lighting, different triggers that a patient might have, or, make sure we're promoting them to be in the most possible environment that we possibly can. I want to address falls. Falls in general for our aging population is very dangerous, but especially our dementia patients are at risk for that. So I'm just going to throw out some statistics on how serious falling is and how crucial it is to have ongoing prevention. So 1 in 4 people over 65 fall each year. 1 of 3 seniors who fall will suffer an injury. 1 of 4 seniors who suffer an injury as a result of falling will die. And 1 of 2 seniors who fall will fall again. So those are some pretty, shocking and kind of grim statistics, but it's the reality of the population that we are working with and trying to keep safe wherever they do call home. Goals of care conversations and advanced care planning are very important with this population as well. Really explaining and planning out the proper level of care for the patient and trying to avoid those hospital and ER visits. It's very, it's a very high concern right now for a lot of our senior population and our family members that we work with. They're afraid to go to the hospital. So it's really ensuring that our patients and their caregivers have the tools and resources to understand, should they be on hospice? Should they be on home care? Do they need, other services to keep that patient safely at home? The healthcare proxies, MOLST forms, our social workers and really all disciplines that we have a commitment to having these ongoing discussions with all members of the family and care team, and that includes assisted living staff because we have many of our patients that are there, and really ensuring that that patient is on the right level of care. Really accessing other services. VNA services are not long-term, they're intermittent, and while they can go on for a period of time, they are not permanent. So it's really, taking a patient-centered approach to each individual patient and transitioning in to other, whether it's a Part B service or other community partners. And we need to maximize that access and the use of all of the benefits for these patients. So it could be looking at personal care services or elder services, addressing things like food insecurities, long-term care planning, and looking at the financial aspects of that. Do they have a long-term care policy? And just making sure that the family is understanding of all of the resources and where the trajectory of this illness could take them and how that impacts their decision making now, and to always have a plan in place is very important. One last note is just the use of hospice, and I know it's a very uncomfortable discussion for many of us, but we have to have those ongoing end-of-life conversations and doing appropriate transitions to hospice and palliative care. Elara Caring and many other hospices do have dementia-certified staff, so they are equipped to properly assess and support patients and families through that time, and helping them identify when a patient is eligible for the hospice Medicare benefit. And we really just encourage, anybody on this call or any family member to utilize these resources that you have and come to us so that we can plan that next level of care. We all have the goals of keeping these patients safe and ensuring that they are educated on what their benefits are and assisting in access to those benefits. So with that, I would like to welcome Nancy.
Well, thanks so much, Jennifer. It's a pleasure listening to what services that you perform, and also thank you, Laura. Great information. Enhancing function and promoting relationships and social participation and finding ways for those with the dementia to enjoy life are the keys to successful therapy intervention. Providing education and support for the family, care providers, clients, and promoting the person's strengths will ensure that those with dementia and their caregivers have the support needed to live life to the fullest. One of the most significant physical benefits that dementia patients can derive from physical therapy is a reduction in that fall risk. Problems with balance and gait can often be lessened by regular physical therapy sessions, thereby reducing any risks of falls, fractures, or other injuries. When someone says that there is nothing that a dementia patient can improve with from a physical therapy standpoint, that's really not the case. So we really encourage that people have a lot of exercise and physical therapy to reduce that fall risk. Occupational therapy interventions for those with dementia include health promotion. So really by focusing on maintained strengths of clients and promoting wellness of caregivers, practitioners can enrich their lives by promoting maximal performance in preferred activities. They also help with remediation. So although remediation of cognitive skills is not expected, practitioners can incorporate routine exercises into interventions to improve the performance of activities of daily living and functional mobility to help restore range of motion, strength, and endurance. Another is maintenance. So practitioners can provide supports for habits and routines that are working well for the person with dementia that can be maintained to prolong their independence. And modification, I guess this is really perhaps the most frequently used intervention for those with dementia, as it ensures safe and supportive environments through adaptation, including verbal cueing, personal assistance, and/or social support. So these are a couple of examples of how occupational therapists can help. Person forgets what season it is when they're selecting clothes. So the care provider sets up limited clothing selections to fit the season, which helps avoid any conflict while supporting the client choice and their independence. A person gets disoriented and wanders. So they set up an environment to enhance daily activities, including mobility with safe confines, and they use technology to ensure safety. Sometimes that's just a fenced courtyard with stop signs and gates that could all that could be all that's needed to keep a person oriented to his or her own backyard. And for others, alarms could be installed to go off when a person opens a door or a gate. A person has trouble communicating along with uncharacteristic frequent outbursts. This can help caregivers identify nonverbal cues, teaching the concepts of caring, non-defensive responding techniques, and working on determining the underlying emotion that might have precipitated that client's behavior or outbursts. And also avoiding correcting factual errors. A person paces or shows other repetitive non-productive behavior, providing opportunities for engaging in occupational tasks that fulfill the person's need to be productive and to help support relationships with others. So for example, a person once enjoyed crossword puzzles, perhaps simplified puzzles or word searches could still be enjoyable. Other repetitive tasks like folding laundry can lead to a feeling of accomplishment. These examples are somewhat simplified, but during the actual intervention, the occupational therapist complete individualized, in-depth evaluations and activity analysis to determine the typical demands of any pertinent activity. They also use critical thinking to ensure the person has the most supportive environment to enhance functioning while promoting that person's strengths and abilities. So as we all are waiting, effective medical treatment for dementia, speech language pathologists facilitate positive impacts on the quality of life for persons with dementia and their caregivers in the face of one of the most devastating diagnoses and life events. The benefit of speech language pathology services for persons with dementia It notes functional progress, positive patient outcomes, guidance for caregivers to enhance communication, and promotion of safe, independent living for as long as possible for that individual with early stage dementia. After those initial diagnoses, a speech language pathologist must first obtain a detailed, heightened awareness of the daily life challenges against which the individual with the early stage dementia is battling. His or her initial loss of independence can be so overwhelming, and we see that all the time. You know, struggles with, but are not limited to denial, depression, short-term memory loss, paranoia, repetitive question asking. You know, at the early stages, they giving up driving, executive functioning, financial responsibilities, and medication management. That speech language pathologist can work on the working memory as a representation of the person's new learning capacity. It details the ability to gain and retain. Oops, hold on. Oh no, I lost my little thing. Okay, here we go. Sorry. It details to the ability to gain and retain new information, and how they can shift gears. So there's lots of different tests that that the speech language pathologist can evaluate, so that they can evaluate immediate and delayed recall as well as recognition. So the widespread question is, can dementia patients learn? Well, there's a hot debate among clinicians, including speech paths, occupational therapists, neuropsychologists, and physicians, as the speech language assessment of new learning capacity is comprehensive and thereby yields development of clinical, appropriate, and effective treatment plans. So that SLP is part of the care planning initiative. Certainly, the field of swallowing and swallowing disorders has highlighted the significance of enduring preservation of both swallowing safety and the quality of life in those diagnosed with dementia. Although there's no, as of right now, there's no gold standard for measuring the dysphagia in persons with dementia, speech language pathologists often utilize comprehensive clinical reasoning skills to tailor effective recommendations, again, to the unique needs of the individual. The SLP offers a safe, effective, and dignified alternative to artificial nutrition and hydration, and reduces the use of nothing by mouth recommendations as appropriate. SLPs are experts in evaluating and implementing the most effective modes of communication. An SLP completes a comprehensive and standardized cognitive assessment and represents results to the team to add to the overall picture of decision-making capacity. In conclusion, the involvement of a speech therapist in the case of geriatric patients is a vital component to the patient's quality of life. Therapy is available through VNA services as well as Medicare Part B providers. We always recommend, if a patient can get a Part A, that gives them a longer time with therapy, and then upon discharge, the person can take on a Medicare Part B provider. It gives caregivers other options for care that are covered by their health insurance. And during the pandemic, healthcare providers follow strict CDC guidelines to keep your loved ones, the patient safe, employees, and family members. Isolation has deconditioned many, and it makes taking a risk of having healthcare workers come to the home more acceptable. I hope this has helped you learn a bit more about how therapy can help. And now I'd like to introduce Gayle Davis from Senior Helpers.
Great, thank you so much, Nancy. Very, very informative. So what I'm going to talk to you this afternoon about is our Senior GEMS program. The Senior GEMS approach was designed by an occupational therapist named Tifa Snow. Many of you may recognize that name. She is a partner of Senior Helpers. It's a method for identifying characteristics of normal aging through late-stage dementia. We use the GEMS as a focus on what people can do and not what they cannot do. And therefore, we can continue to help them live a purposeful life in their own home or wherever their home is. So when we talk about the Senior GEMS program, it is based on the Allen cognitive disability theory. Each GEM that we're going to discuss represents a different stage of dementia. We start with the sapphire, and then we move through to late stage dementia or the pearl. We use these GEMs to help understand the changes that are taking place, to know what our clients are still able to do, and that enables us to provide the best care possible. So if we start at the top with a sapphire does not have dementia. They actually are experiencing normal aging. They may have some forgetfulness and difficulty learning new things, but guess what? They can learn some new habits. Sometimes they may feel blue or down, but guess what? They're coping with aging. They're coping with their body changing, not being able to maybe keep up with their grandkids, just as an example. Sapphires, above all, they want to have choices. When you think about normal aging, here's a little example. Think about it when you think of a car. So you get a new car, right? You got that red Mustang and it runs really smooth. Almost no maintenance needed in repair. As time goes on, however, repairs are needed to maintain function, just like our body. The time comes when parts are wearing out and you have to fix and replace them. And eventually some of the parts, they don't even really function anymore. It doesn't mean that the car doesn't work. It just means that you might have to change the way you're doing things with the car. For example, if you used to get an oil change every 3,000 miles, you might need to get an oil change a little more frequently. Again, might have to give it a little bit of time to warm up on a cold day. Think about how that relates to our body. So then we go to the next stage. And the next stage is the diamond. And if you think about a diamond, it's bright, it's clear, but they're very rigid. In other words, a diamond can still do the things that they always have, but they struggle with new information. So diamonds can be, again, very rigid, just like the stone. They can be hard and totally inflexible. They put the walls up, but they also shine. And sometimes they can be perfectly fine. You'd never know that there's any cognitive decline whatsoever. They can do what they've always done. But they can get upset when things change. So an example I like to use about a diamond is that I was driving down the Spalding Turnpike one day, and my mom told me to take exit 6. And I'm like, no, I should take exit 7. She's like, I've been driving for 35 years. You take exit 6. So guess what? I didn't want to get in an argument. I took the exit. It was the wrong exit. We ended up getting where we were going, but diamonds are very rigid. They like things the way they always have. So maybe she took exit 6. I liked 7 because it was a shortcut. They have many facets. So it's possible that different people see different sides of that diamond. So a family member may see their mom as one way, but their caregiver may see mom as another way. We all know that family members are the ones that put the walls up the fastest because they're protecting themselves. They don't want you to see that they're failing. The most important words that you'll use with a diamond are, I'm sorry. If you've crossed the line, don't try to explain your way out of it. Just say, I'm sorry. Diamonds have trouble learning new information, but they sure the heck can remember those good old stories. Then we move on to an emerald. If you look at, if you think about an emerald as in a stoplight sequence, the green means go. Emeralds are on the move. They're moving in time and tend to get, they are moving in time, but tend to get lost in past life, places, and roles. So a good example is we were asked to come in to a memory care facility, and they told me that this one woman, every day, she would come out of her room and she would usher everyone into their rooms. They couldn't figure out what she was doing. And so I started asking some questions, and lo and behold, this lady was a former nurse. But what she was doing was she was clearing the hallways. She was getting everyone into their rooms. But when people didn't go into their rooms, she got very upset. So in talking to her, she was very intrigued with a binder that I had in my hand. It now became her binder. That was her nursing book. And after they let her carry this book around, because she was stuck in the past, she was still working. They never had behavior problems with her again. So with emeralds, things are not always as clear or sharp. They're becoming very vague. Although many of the flaws are still hidden, they're time travelers. They get lost in the past life, places, roles. They may be in Derry, New Hampshire, but mentally they're in Darien, Connecticut. They think they're fine. When you correct them, they get very emotional. They make mistakes but don't realize it. Turn the microwave on, for example, and there's nothing in it. They may do something over and over again or completely skip it, like making a favorite recipe, a recipe that they've made off the top of their head for years, but all of a sudden they're making it and they forget to put the milk in it and then can't figure out why it doesn't taste right. Asking questions about what, where, and when, again, due to becoming lost in time. They like to have choices. Don't take that away from them yet, as long as they are safe choices. So now we're moving on down the line to what would be referred to as stage 4, or in our case in the GEMS world, it's an amber. This is a point where you're thinking about, you look at the stoplight and it's yellow. What does a yellow light tell you to do? Slow down, okay? They're slowing you. So in that respect, we need to slow down our rate of speech with an amber because they're not processing it as fast as they used to. Need to slow down when doing activities. Don't run into a room and say, "Good morning, Mr. Smith. This morning we're going to get up, get dressed, giving a whole list of to-dos. Good morning, Mr. Smith. It's a lovely day. We're going to get up first before breakfast. Process. Then we're going to let's go use the restroom. Process. So each time you're going to state one task to do, complete that task, always giving encouragement along the way, because they can now only do one thing at a time. They are either very private or quite noisy. Oftentimes you see that behavior exhibited when people are dining together. Something can agitate them, and all of a sudden going from a quiet moment very loud and maybe a little unruly. They can pinch, scream, hit if they don't like what's happening. Again, noticing these types of behaviors, you want to be able to redirect and keep your distance. The visual field is now getting smaller, and the speech at some point can become difficult to understand, vis-a-vis referred to as word salad. And they have at this point have lost the ability to understand long sentences or directions. So again, this is a time when we're slowing down. We're keeping our conversation very simple and to the point. Now we're going to move on to the ruby. And I absolutely love rubies, but this is a really, really difficult stage in someone's life with dementia. A ruby is chosen to represent this stage because it's the color of red. Again, equating it to a stoplight. Stop. At this stage, fine motor skills in the mouth, the eyes, the fingers, and the feet basically are stopping. As caregivers, we also must remember to stop or slow down our actions when we are working with clients at this level. And the reason being is that we don't want to go too fast in terms of if we're doing putting on lotion, or if we're doing a bed bath, or even assisting in the shower if they still have the ability to get into the shower, because we need to slow down with them. One of our clients just said to our caregiver the other day, I want to teach you how to breathe like me so you can slow down to my level. At this point, more frequent falls because we're losing the loss of fine motor skills. Oftentimes, taste has changed so that weight loss and skin problems are come about due to the difficulties in eating. They struggle with going from walking to sitting. So if I stand up, at this point, what you want to do is hopefully they're using a walker or arm-in-arm assist, and not a rollator with wheels on it that can go out in front of them too far and fast. But they're going to need that exact guidance to keep them from falling, because they are going to be, again, unsteady on their feet due to the loss of fine motor skills. Many times the vision at this point becomes monocular, seeing like you're looking right out of a straw, no peripheral vision. They no longer get into things. The interest level is waning, but they might want to carry something. So at this point is where you might want to introduce a soft stuffed animal, nothing that they can pick the eyes off of it or anything, or even a baby doll. The sleep and wake cycle is absolutely destroyed. So the circadian rhythm, it's out the door. It doesn't matter if it's daylight or nighttime. They're going to sleep when they want to sleep. They're going to be up when they want to be up. Many times it's suggested to treat this with medication. I would say that if you treat it with medication, you're sort of playing God a little bit. So really try to work with them so that they are calm and quiet, and when they're sleeping, let them sleep. Because they, at this level 2 or ruby, they are going to be sleeping quite often. And most of the time they may be lost in, quote unquote, lost in another world. The reason being is that their body's changing. They are beginning to shut down. And most of the time they are beginning to transition to the next gem, the pearl. When you're moving from a ruby to a pearl, you're hardly moving, you're having swallowing problems, and you're really, really unaware of the world around. Moving to the pearl or end of life. If you think about an oyster and the outside of an oyster, it is rough and gnarly and it's not attractive. But if you open it up, you have this absolutely gorgeous pearl, this gift. That's the person who is really there. And that's what we have to recognize. This becomes the very difficult level for families, because they can see their loved one changing in front of them, and there is nothing that they can do. My advice is to, speak to them. They can still hear you, recount stories, read poetry, keep them warm and comfortable. They like soft textures, so there's so many beautiful soft blankets out there. And then again, focusing on slow and smooth movements. I promise you, if you adhere to these GEM levels in the program, you will have a successful transition through the stages of dementia. And so that is the end of my presentation. And on behalf of all of us here on the call today, we would like to thank you for attending this informal session regarding local resources who can assist clients and families facing dementia. We hope this is the first of many resource sessions that we host. We're going to now open up to the Q&A. We ask that you direct questions to one of our panelists directly. With that, I will turn things back over to Laura, and thank you all so very much.
Thank you very much. What great presentations, what great gems that we're going to be able to walk away from. I want to, I have a few questions here that I would like to address. The first one is for you, Jennifer. What is the cost and how do I access the benefits?
Sure. So VNA and hospice services are Medicare Part A benefits, so there is no cost involved. So it's very important that we're always assessing and reassessing qualifying for that so that we don't have costs unnecessarily to patients. And it's really a matter of getting an order from the physician, which we can help facilitate that process as well.
Thank you. The next one would be for Nancy. Where can we receive services?
We cover the New Hampshire region up to as far as Manchester. We also cover to in Massachusetts. So the best thing is to send me an email to say where you live, and we can say if we can come to your home to treat.
Wonderful. And this one is for myself. How long is a memory screening? And memory screenings will take about a half hour or a little more, depending on how many questions that you have after the screening is done. The first part of it is just getting medical information, understanding your background. Then the screening doesn't take more than 15, 20 minutes. But a lot of times people have a lot of questions for our coordinator, and they will take a little bit longer, but we put aside time for that. And for Gayle, when you talk about normal aging, what does that mean?
So normal aging is sort of the progression of our life as we get older. We can continue to be independent in most of our daily activities. We may complain about memory loss, but it's just a mere momentary forgetfulness. I might forget somebody's name at the moment. Occasionally, we might find a word, searching for a word that just doesn't come to the tip of our tongue at the moment. And we can still we can operate appliances, we can drive a car. We're just slowing down a little bit.
Okay, that makes sense. Jen, this one is also for you. Do I need to see my doctor in person before I receive in-home services? That's a good one.
Yeah, so traditionally that would be the case. However, CMS has changed the rules in allowing the initial face-to-face qualifying evaluation to be done through telehealth. And we really encourage that because we do find that more and more patients are more apprehensive to get out to the doctor. So that can be done via a telehealth visit.
Wonderful. Nancy, how can we make a referral to your organization?
Pretty easy. You could just call our phone number, and our intake coordinator will take your information, and it's as easy as that.
That's great. Now for myself, do you offer phone screenings? Telehealth is definitely something that is becoming more and more widely used, and we also are offering phone screenings for memory at this time because it is something that is widely accepted now, and it is something that we're finding people are looking for a memory screening, but they're hesitant to come into the office. And then what do you do with the results? Well, with the results that we get from the phone screenings, or the memory screenings, is completely entirely up to the participant who comes in to get the memory screening. If they would like it shared with their physician, they can sign a consent and we will share that with them. Otherwise, it stays between us and the participant. Now, just want to, one more for Gayle. What is the difference between Alzheimer's and dementia?
So dementia is like the big umbrella, okay? Or if you want to equate it to a different example, it's like a Ford. And then underneath that category, dementia, are many different types. So you have Alzheimer's, you have Lewy body, you have frontotemporal, you have vascular, you have Parkinson's. So dementia refers to the group of symptoms that include confusion and disorientation, memory loss, behavior changes. Alzheimer's is a disease. It's a particular form of dementia. So most common mistake, we hear people say, oh, they have Alzheimer's dementia, or they have dementia, Alzheimer's. Dementia is the umbrella, like the Ford, and Alzheimer's is like a Taurus. It's a disease. It's the most common of all forms of dementia. It's estimated that somewhere between worldwide 2.4 to 5.1 million people have Alzheimer's. In this country, every 30 seconds, someone is diagnosed with Alzheimer's. It's very, very scary.
Wonderful. I did have someone ask what the phone number was, and our last slide, which I will put up so that people can actually take information on, there is a thank you, but I want to check a couple more questions. And so I'm going to give you a little bit of opportunity to take down the information. I will leave that up for a little bit. And that is the information on all four of our speakers today. I want to thank all of you for coming. I will share the information from the Molly, who has set up information on Memory and Partners. We would absolutely love to be able to help you and have you help us as well. I want to thank everyone for attending and look forward to future webinars that will help get the information out and help with all of them. For one last note from each of you, Jen, would you like to share one more nugget, and then we'll go to Nancy and Gayle?
Oh, sure. I just want to thank everybody for taking the time. Please be sure to reach out for any questions. There's a lot of providers out there. We're all acting and making decisions on the best interests of our patients, and we're here as a resource for everybody.
Thank you, Nancy.
This is Nancy. I think the whole purpose of this call too was to let people know that there are so many options for people to get services, and we all want to work collaboratively to give the best care for the for people that are suffering with dementia, and also to help the caregivers get services that they can will in fact give better outcomes for their loved ones.
And before you go on, I just want to say your slide with all of the gems and information on that is invaluable to people who are dealing with a loved one and the caregivers. I want to absolutely give you kudos, and Teepa Snow's organization and working with her, because that really helps people to understand what stage they're in and what they need to do. But any last nuggets you'd like to give, Gayle, please?
Well, yes. If you liked a little bit about what I was talking about, the Senior Gems program, then I'm going to give you a little inside tip that on May 6th, 2021, Teepa Snow will be coming to New Hampshire. We will be hosting her again, as we did in 2019. More information to follow. We haven't set a location yet, and we don't know what the guidelines are going to be at that time due to COVID. But spending a day with Tifa Snow, I promise you, is one that you will not forget.
And
I think all of us are Tifa Snow followers.
yes.
If you're not, we're going to convert you.
That's right.
Well, I attended 2009, and was it 18 or 19? The last one that you had, and it was fabulous.
Thank you.
So thank you everyone for coming today. We really appreciate your participation, and we look forward to connecting with all of you at our Zoom networking events, as well as we open up. Thank you so much, and have a wonderful day.
And you as well. Thank you.